Major Dr. Ashlesha Tawde Kelkar, Consultant Digital Health, Maharashtra University of Medical Sciences, and she has come from all the way from Mumbai and who has already served the armed forces. Can we hear applauses for Dr. Ashlesha, please?
Namaskar. Good morning to all. Good morning to the panelists, respected. It has been an enriching, discussion and experience from everybody. I am in the practice of public health currently. I work in the Rural Health Training Center and tribal villages in Maharashtra. What is the role of these medical colleges when it comes to the cadre, public health cadre? And when we say that there are resources which are constrained, what do we really mean by that? What are the challenges first of all, and how do we really overcome on ground? First of all, of course, the medical colleges, to be a part of this public health system, is already being implemented from the government side. So medical colleges have an existing infrastructure, an existing set of teachers, trainers, particular modules, which can be utilized for the, not just for the cadre, but also, sir, when we are talking about the primary health center or sub-center or community health center, CHCs, we are not really talking about specialists or even MBBS doctors. Here, we run the show with the help of community health workers. Community health workers are Ashas, Anganwadi workers. And these were, as we all know, these were the soldiers. I am a soldier, I have come from armed forces. These were the soldiers during COVID. It was not us, not exactly the doctors, because in fact doctors were not allowed in the community. The villagers were not letting them come inside from the hospitals. It was these people, it was those Ashas, Anganwadi workers, and ANMs, auxiliary nurse midwives. These are the people who are actually working on ground. There is one more post. I don't know how many people know about this. This is a CHO, Community Health Officer, who need not be an MBBS, who can be from allied health sciences, who can be from nursing, and mans a sub-center. I am very proud to say that in India, rural healthcare delivery system is one of the strongest. One of the strongest healthcare delivery system. We do not find such system even in developed countries. But what is the challenge here? Like sir mentioned, yes, challenges are many. We are going to digital age. I am also working with digital. So we think that if we are in the rural, we don't want to talk about technology. If we are talking of technology, we are talking of cancers and super specialties. No. Digital health is one, but digital public health is what we are looking at. India is the most populous country today. Is that a blessing? Is that our problem? What is it? It is upon us to decide. The most populous country and one of the youngest country across the globe. It is our strength. India is the most populous country. We have the most critical of the resources, that is the manpower. Today, we have the manpower, the young minds. What is required is training them correctly. So if I'm coming from a rural background and I'm looking at rural healthcare, it does not mean I leave aside the technology. Public health technology is where we are heading. Like Sir mentioned, Aadhaar card. Few of us know about it. Some of us have it already. But in due course of time, I'm sure everyone will be having this. Everyone will be talking about this. This is one of our visions and we are working towards. The role when it comes to teaching faculty, this is where we are supposed to concentrate, not making super specialities, but training the community health workers, the nursing staff, because when it comes to telehealth or telemedicine in the rural, a super specialist, maybe a neurologist, will not go there and operate. But a nurse who identifies a stroke early and refers the patient to a hospital fastest with the help of infrastructure will be able to save that one person. At the same time, there has to be awareness. So, awareness in the community. And there the digital health will help, even in the rural. We have approximately 8.9% or more population which is tribal population. This much population which is available to us, which is part of us, unless this comes in mainstream, we are disabled. Apache hai. 104 million people. When we talk of India, it is numbers, sheer numbers. These are not burden. These are the strength of our country. This is the real strength of our country if trained, channelized in a proper way. For which, like Madam mentioned, there have to be institutions for training. And not just super speciality or apex institutes, but also training institutes for the lower rank of healthcare workers at every stage. At every stage. There is something that they say that, how do we really create a future-ready workforce, health workforce? What is future? What is ready? What is force? What is the future that we are looking at? Is it only digital? Is there any human interface? Is technology going to replace us, doctors? Many of us are really scared. General practitioners say, patient chat GP, Google लेकर आ जाता है diagnosis. He will ask us, हमको ये वाला investigation करके दीजिए और ये वाला दवाई दे दीजिए. No, technology can never really replace a human interface. It can augment, it can assist. When we say of, future-ready workforce, it is everybody included, not just urban, not even only rural, which is the 70% of our, 60 to 70% of our population. Not only them, not just tribal, all together. Like how much diversity we have in our country, all of us going forward into future together, matching our steps. It has to be at one pace. It is not only the technology. Technology everywhere. Advanced countries have advanced technologies. We too have technology. What makes us cut above the rest? It is the ethics, governance, if that is being maintained and that again being taught. Ethics, governance, technology without ethics is a vice. It is a monster if not handled with governance, with care and ethically. And that is how the governance part, the management of public health has to be at the very basic of our training. The public health training, the community medicine or preventive social medicine that we talk about is changing. Last few years we have seen NMC has given so many beautiful changes to the medical, paramedical curricula. We adopt families in the villages. The students go to these families and interact. What are they doing? They're not using technology. They are creating human bonds. These human bonds will make them rooted, keep them rooted, and make them stronger. Technology can only assist, make it better. But at the basis of it is human-to-human relation. And that is how, as Indians, we all are together. It is the ethics and governance that we are talking about in digital health that will bring us all together. We are considered, across the world, we are, as Indians, we are considered, law-abiding, good citizens, generally not going the wrong way. This kind of behavior is not just a perception. It comes from our roots. While we are going up and advancing and going to become the global power in few years, not forgetting our roots is the key to stay strong, to stay cohesive, to stay together as one. Like Madam mentioned, like Sir mentioned, we have diversities, we have various other problems, but being together, being one, and being right is our strength. I think when we put this kind of training, this grilling, in our young generation, upcoming generation of public health, and all the healthcare cadres, we can achieve what we are looking at, India as the global leader. Right, sir? Thank you.
Thank you, madam. You brought out very important points. One is the digitalization, complementing or accepting the IRs and tertiary care center people, and ethics. One important thing you brought out, ethics. That's very, very important things. More than digitalization, ethics is, I think one should really follow ethics. Thank you very much, madam. I think Dr. Biswas is waiting. Can you have an, is he available?
Sir, ma'am, you have touched upon the ethics. Ethics is the one, it's not only for the medical fraternity. What I feel, to whomever would like to come, our younger generation would like to come to the public health, the first they should have a humanity in their hearts. I want to serve to my society. I want to serve to my nation and to my world. So when that it comes into their mind, even though they are in a different fields, it's not a doctor or the nurse has to do it. Everyone should have a humanity. Once that human touch and ethics are there, definitely the public health, because I'm living in the world of TB. Tomorrow I may get it, my mother may get it, or my child may get it. If we have that apprehension, definitely we will take all measures. So I think in all the professions, all the youngsters who are going to come into this cadre, so I request on this platform, you should have an empathy, you should have a humanity, you have a touch to the feelings. And then it's a prevention. Because for the clinical management, yes, patient acha hua, theek nahi hua, there is something you can put a bar. But for the prevention, there is no bar. And then your heart itself, and then it has to say. So I would like to add upon. Thank you.
Yeah, can I ask Dr. Viswas to speak on his views on changing face of public health?
Yes, sir. Good morning to all of you, sir.
Yeah, good morning. Can you go ahead? You can go ahead, please.
Respected chairperson and the other dignitaries on. I am extremely sorry and apology for not being there in person. It was some unavoidable situations in our institute. First of all, I'd like to thank the organizers, Indy Global, for inviting me in this very special second health care summit. So just all the speakers, I think, covered almost the important things that I'm going to just a few comments on the digital health, public health. What is the scope of digital in the public health and different institutions? Being the tertiary care hospital, the AIMS, here in Bhubaneswar, sir, what exactly we're doing this? I will go for a quick, probably a overview on that. So, if you talk about the sector, health industry, now digitalization of the health system is a very important. Patient care services. That's the mission mode now the government of India has taken a digital health as a APTN, Ayushman Bharat, digital, which is covering the all in Java and this health active, and that creates probably it is not only the patient but also the health care provider registry. So this is this is going to create a one platform. That is what we need. And the single digital platform is going to help, and that is how we are going to work. If the one hospital is the health record of the patient, that should be accessible anywhere in India. Because of this software, this program, health, the probably national health, the authority is now going to create all this in putting in one health everywhere, so that everybody should, the data should go. There are several issues are there. Data safety and management. We take care of the national health authority. So, so digital of the about the health providing the services to the healthcare recipient, the patient, and in between is the system. We are trying to digitalize. So most important the healthcare setting transforming into digital platform. So what are the components where we are doing here? E-hospital, health, and that's everybody that target those aspect in the. So e-office, e-health, hospital. In that most challenging thing that we are facing now is the e-prescription. We are e-prescription is when a doctor is seeing a patient, recording this history and transforming into the digital platform history. And when the patient sees, examining a patient and the signs and the symptoms, those things into writing in the electronic format and a platform, it is time consuming by the doctors. So there is not much of time to do that. So how we are going, we have gone into the stage of e-prescription. That is the important thing. So that probably it will be a complete digital platform for providing the service to the patient. Everything is digital, no paperwork. So this is the only area where we have to start, and we're struggling almost. We are going for it to complete the prescription part because everything. So there are things you can do it by we have the voice that is going to record the symptoms of a doctor repeating it. So there are many ways. So it is, I think, digital platform, making a single account of an application across the world, across the nation is the important thing. Because patient may not have the data or the record of hospital when they go to other states. So when they go to other state with the hospital can easily see their whatever things, whatever treatment, what are generated and seen by the doctor in one hospital, we be transferred into the other hospital. That is the beauty. I think this is a very national the registry, and all the doctors, I think care provider registry versus for the healthcare provider, they are also recording it in one platform. And many things I think if you go for the digitalization of the health system to definitely help the services in the and hospital. So, and the e-governance is one of the everything comes in the hospital e-governance or good governance and this all everything transfer to. So, I hope there are many steps to improve healthcare services by adopting all this digital technology in the healthcare system. Thank you, sir. Thank you for giving me the opportunity to share my views.
Thank you, Dr. Biswas. I think you have stressed upon the digitalization, and I'm sure there will be a lot of questions, and because of lack of time, I don't think we'll be able to answer. Do we have some time? Madam, do you have some time? Any questions? I'm sure the panelists will be happy to answer. So if there are no questions, yeah, please. Can you please give mic there?
So in USA there is a MS in digital health, sir, and it's going on for quite a long time. After MBBS, the doctors can do MS in digital health. That would be very good for our country also, sir, because most of the programs, most of the e-learning and most of our statistics all are based on digital health, sir. So we also should, because we have advisor to government of India and government of Telangana, I think we should also try to at least have note prepared for having in our country, sir. MS in digital health, sir.
Yeah, that's what we were discussing. Digitalization, yes, the government of Telangana is quite interested. We have in fact at the Nizam Institute of Medical HMS system and CDAC system.
Post-graduation, sir. It is a post-graduation.
A course, you mean?
Yeah. After MBBS, this MS course is there on digital health in America, sir. And that is a very successful program for last 10-15 years. It is very sort of one of many of our doctors' children are doing this course, sir. I think that would be very good if we can at least write to our government of India and from Telangana government also, our health universities to have similar course.
Similar kind of a course.
Yes.
Yeah. You want to answer?
Thank you, sir. That is a really great point you brought up. Actually, when it is going towards digital health, the boundaries of, doctor, engineer, these kind of career boundaries which do not exist, they exist in our minds, they are blurring. What we saw during COVID was the people who were serving in the hospital had certain ideas and certain experiences, whereas the models that were made by people who could not ever enter the hospitals. There was a large gap. The models were made by people who are tech savvy and in coding, in ML, AI, and are not all those things. So all of us know that there were many models, but none really predicted, nowhere around the globe. And that is where we actually have felt the need for a health force which is a bridging bridging kind of a force between the medical and the technical, careers or lines of working. Because the way a computer engineer's or a computer techie's brain works, it's far different than how a doctor thinks. It does not happen every time 2 + 2 4 inside a human body. All of us agree. But for a coder, it has to be so. So the codes or the programs have to be made in such a way that they address medical problems in real time. But do doctors have to learn coding for this? Maybe a few. Need not make the programs, but they can be this bridging force which can tell those who are hardcore techies what we require, what the problem is, so that he can provide a solution. So digital health, when you're talking about a course, yes, these courses are in pipeline. There are IITs across the country who are working towards it, along with the medical Apex institutes for digital health. And digital health has a mix of trainings. So there are some people who are hardcore computer and then AI, ML specialists, along with doctors in various fields. And it's a let's say mix. It's a good combination of teachers, trainers, which can provide digital health training for not just doctors, even computer graduates or engineers who are coming towards the newer futures, the professions which have not existed before, and now they are existing in a big way. These courses are in pipeline. In fact, few of them are already out. We all are working on it, sir. Thank you, sir. Thank you very much.
Thank you very much. And if there would like to
Yes, as you said, it's true. When you talk about the digital health, it comes from us only. Whatever they implemented by the government of India, or it may be a government of Telangana or government of AP, almost 156 different programs they are running in a different apps. So every time, whenever we get any type of issues, like a TB program is there, so under Nikshay, so everything we will enter into the Nikshay. Now the real-time data we can do it, the budget, the financing, everything we are doing, and then we are updating everywhere. Even in Telangana, there is a Talli Bidda RMNCH program, and then they're doing it. So every Nikush, and now HMIS data, as sir said, IDSP, IHIP portal, that's the one, epidemiological surveillance, entomological surveillance, so wherever the emergency response. So we are going towards the digital mission programs, and as you said, PMABeam, under the PMABeam we are doing Abaka Arts and all these things, Ayushman Bharat programs, E-Sanjeevani, E-Digital. So as sir said, definitely, and then after the MBBS, if they have a knowledge about the digital health, really it will be helpful to the doctors and as well as to the community. You rightly pointed out, sir. Thank you.
Thank you.
Thank you. I thank all the panelists for a fruitful discussion, and I close the session. Thank you very much.
Thank you. Thank you so much, sir. Of course, it was very wonderful to have different perspectives about the challenges and how to mitigate them. I request the guests to please stay onto the stage. And now, we are joined with our very esteemed guest for the day, Dr. Karthik Adappa, IAS Special Secretary, Public Health and Family Welfare Department, Punjab. Can I request you to please come onto the dais, sir, to give away mementos to our speakers here on the stage. Can I please request Dr. Anuradha Meadowjuice to please come forward to receive a memento from a speaker. Further, can I request Major Dr. Ashlesha Tawde Kelkar to please come forward. May I call upon Dr. Nagari Birappa to please come forward and accept the token of appreciation. Can I call upon Dr. K.V. Ramana Reddy, Dean Mallareddy Dental College for Women, Hydrabad. Can I further call upon Shri Sharad Anand Chupali, MD, Shiva Medisoft Services, Hyderabad.